Welcome to another exciting pharmacology quiz in our series, where today we'll be testing your knowledge on antidepressants. In this video, we'll explore drugs used in the management of depression and related mood disorders. The quiz features 10 multiple-choice, scenario-based questions to challenge your understanding. Each question comes with 5 answer options, followed by the correct answer and a brief explanation. There's also a companion video offering a comprehensive review of antidepressants. Its link is available in the description below. So, let's get right into it. Question 1. Mr. Anderson, a 42-year-old man with major depressive disorder, has been prescribed flaxetine. He has a past medical history of generalized anxiety disorder and hypertension controlled with amlodipine. He presents complaining of restlessness, tremor, diaphoresis, and confusion after starting over-the-counter cough medicine. Laboratory findings reveal elevated creatinine kinase, which normally ranges from 25 to 200 units per liter. Which of the following best explains this reaction? Option A, inhibition of serotonin reuptake. Option B, excess serotonergic activity due to drug interaction. Option C, antagonism of muscarinic receptors. Option D, blockade of dopamine D2 receptors. Option E, inhibition of norepinephrine reuptake. The correct answer is option B, excess serotonergic activity due to drug interaction. The explanation is that this presentation is most consistent with serotonin syndrome, triggered when flaxetine interacts with other serotonergic medications like certain cough suppressants. The excess serotonin activity causes autonomic instability, neuromuscular abnormalities, and altered mental status. Elevated creatinine kinase can result from muscle rigidity or tremors. The other options do not explain the acute syndrome described in this case. Question 2. Mr. Davis, a 30-year-old man with depression resistant to 2 SSRI trials, is started on phenelzyne. He presents with severe headache, very high blood pressure of 210/120, and palpitations after eating aged cheese at a party. This crisis most likely occurred due to which mechanism? Option A, increased dopamine degradation. Option B, excess serotonin receptor stimulation. Option C, accumulation of norepinephrine from tyramine ingestion. Option D, inhibition of acetylcholine esterase. Option E, excess GABAergic stimulation. The correct answer is option C, accumulation of norepinephrine from tyramine ingestion. The explanation is that monoamine oxidase inhibitors like phenelzyne block the breakdown of dietary tyramine. Tyramine displaces norepinephrine from storage vesicles, causing a sudden surge in blood pressure known as a hypertensive crisis. This explains the severe headache, palpitations, and dangerously high blood pressure. The other options do not account for the dietary trigger and the classic tyramine-MAOI interaction. Question 3. Mr. Harrison, a 58-year-old man with a 10-year history of chronic neuropathic pain and type 2 diabetes, is being managed with gabapentin and metformin. He also exhibits signs of depression and insomnia. His blood pressure averages 150/95. The clinician plans to start an antidepressant that may help both depression and neuropathic pain but wants to avoid raising blood pressure. Which of the following would be least appropriate? Option A, duloxetine. Option B, amitriptyline. Option C, venlafaxine. Option D, nortriptyline. Option E, desipramine. The correct answer is option C, venlafaxine. The explanation is that venlafaxine, especially at higher doses, increases norepinephrine levels and may cause dose-dependent hypertension. Since the patient already has elevated blood pressure, venlafaxine would be a poor choice. Alternatives like duloxetine or tricyclic antidepressants can address both depression and neuropathic pain without the same hypertension risk. This makes venlafaxine the least appropriate in this scenario. Question 4. Mrs. Clark, a 65-year-old woman with generalized anxiety disorder, is currently on escitalopram. She complains of dizziness and hyponatremia with a sodium level of 125 millimoles per liter. Her medical history includes osteoporosis and mild cognitive decline. Her GP suspects SIAD secondary to SSRI use. All the following statements regarding SSRIs and electrolyte disturbances are true except Option A, older adults are more prone to SSRI-induced hyponatremia. Option B, SIAD may result from enhanced ADH release. Option C, symptoms often resolve after stopping the SSRI. Option D, flaxetin carries no risk of hyponatremia. Option E, monitoring sodium is recommended in elderly on SSRIs. The correct answer is option D, flaxetin carries no risk of hyponatremia. The explanation is that all SSRIs, including flaxetin, can contribute to hyponatremia, particularly in elderly patients. The mechanism often involves inappropriate secretion of antidiuretic hormone. Symptoms usually improve after discontinuation of the SSRI, and monitoring sodium levels in older adults is strongly advised. Therefore, saying flaxetin carries no risk is incorrect. Question 5. Mr. Johnson, a 33-year-old man with major depressive disorder, reports persistent low mood despite several SSRIs. His psychiatrist considers monoamine oxidase inhibitors as the next option. Before initiation, dietary counseling is given to prevent hypertensive crisis due to tyramine interactions. Which of the following foods should he strictly avoid? Option A, fresh milk. Option B, aged cheese. Option C, cooked white rice. Option D, boiled chicken. Option E, fresh apples. The correct answer is option B, aged cheese. The explanation is that aged cheese contains high levels of tyramine, which can precipitate a dangerous hypertensive crisis in patients taking monoamine oxidase inhibitors. Fresh foods like milk, rice, chicken, and apples are generally safe. Patients on MAOIs must avoid aged, fermented, or cured foods to prevent life-threatening blood pressure surges. This makes aged cheese the key dietary restriction. Question 6. Mrs. Stevens, 72 years old, has been taking amitriptyline 25 mg nightly for neuropathic pain. She reports confusion, blurred vision, and constipation. Her heart rate is 104 beats per minute. The physician suspects anticholinergic toxicity due to drug accumulation. Which of the following pharmacokinetic factors most likely contributes to her symptoms? Option A, increased hepatic metabolism with age. Option B, increased renal clearance in elderly. Option C, decreased hepatic metabolism with age. Option D, enhanced plasma protein binding. Option E, increased gastric emptying rate. The correct answer is option C, decreased hepatic metabolism with age. The explanation is that drug metabolism slows with aging, especially for medications like tricyclic antidepressants that undergo hepatic clearance. Reduced liver metabolism leads to higher plasma concentrations and increased risk of toxicity. Elderly patients are particularly sensitive to anticholinergic side effects such as confusion, blurred vision, constipation, and tachycardia. This explains Mrs. Stevens' presentation of drug accumulation and toxicity. Question 7. Mr. Parker, 27 years old, presents to the emergency department after an overdose of amitriptyline. He is drowsy, has wide QRS complexes on his electrocardiogram, and is hypotensive with a blood pressure of 85/55. Which of the following is the most appropriate antidotal therapy? Option A, activated charcoal only. Option B, flumazenil. Option C, sodium bicarbonate. Option D, physostigmine. Option E, atropine. The correct answer is option C, sodium bicarbonate. The explanation is that sodium bicarbonate is the treatment of choice for tricyclic antidepressant toxicity with ECG changes such as QRS widening. It works by stabilizing cardiac membranes and counteracting sodium channel blockade. Supportive care, including fluids and airway protection, is also important. Other listed options do not directly address the life-threatening cardiac effects of amitriptyline overdose. Question 8. Ms. Thompson, 25 years old, is newly diagnosed with postpartum depression. She is currently breastfeeding and wants to avoid drugs that may harm her infant. The physician must choose an antidepressant with the best safety profile in lactation. Which of the following is the most suitable option? Option A, sertraline. Option B, flaxetin. Option C, venlafaxine. Option D, amitriptyline. Option E, bupropion. The correct answer is option A, sertraline. The explanation is that sertraline has the lowest transfer into breast milk among SSRIs, making it the safest choice for women who are breastfeeding. Flaxetin has a long half-life and can accumulate in infants, while venlafaxine and bupropion are less studied and may carry risks. Amitriptyline is generally avoided due to sedative and anticholinergic effects. Therefore, sertraline is preferred in postpartum depression for lactating mothers. Question 9. Mr. Miller, 44 years old, presents with depression and nicotine dependence. He expresses interest in a medication that may aid in smoking cessation while treating his mood disorder. He has no history of seizures. Which antidepressant would be most appropriate for this dual indication? Option A, bupropion. Option B, mirtazapine. Option C, trazodone. Option D, sertraline. Option E, escitalopram. The correct answer is option A, bupropion. The explanation is that bupropion is unique among antidepressants in that it also promotes smoking cessation. It acts as a norepinephrine and dopamine reuptake inhibitor, reducing nicotine cravings and withdrawal symptoms. It is an excellent option for patients with both depression and tobacco dependence, provided there is no seizure history. The other listed agents do not have proven benefits for smoking cessation. Question 10. Mrs. Hughes, 40 years old, with treatment-resistant depression, is being evaluated for augmentation therapy. She is currently on flaxetin 40 mg daily. The psychiatrist considers adding lithium. All of the following statements about flaxetin-lithium combination are true except Option A, increases risk of serotonin syndrome. Option B, may require lithium level monitoring. Option C, can be used safely without supervision. Option D, may enhance antidepressant response. Option E, both drugs affect CNS serotonin levels. The correct answer is option C, can be used safely without supervision. The explanation is that combining flaxetin with lithium requires careful medical supervision due to potential drug interactions and toxicity. This combination may increase the risk of serotonin syndrome and always requires monitoring of lithium levels. When used appropriately, lithium can enhance antidepressant response and improve outcomes in resistant depression. However, it should never be considered safe without close clinical oversight. Conclusion. That wraps up our revision on antidepressants, and I hope you found this quiz both engaging and insightful. Quizzes like this are a great way to reinforce your understanding and identify areas that may need a little more focus. For further reading, I recommend referring to Katzung and Trevor's Clinical Pharmacology, Rang and Dale's Pharmacology, and the British National Formulary, BNF, for up-to-date drug information and guidance. These resources will deepen your grasp of mechanisms, clinical uses, and safety profiles of antidepressant drugs. All guideline references in this video specifically follow the BNF, so be sure to consult it regularly as you continue to strengthen your pharmacology knowledge.